Welcome back. I'm here at Coastal Vascular and Vein in West Ashley, and joining me today is Dr. Edward C. Morrison, and he's going to be talking to us today about this state-of-the-art endovascular center, actually one of the only kind here in the region. Dr. Morrison, thank you for having us.
Thank you. Good morning.
Now, what types of conditions do you treat here at the center?
We treat blood vessels of all kinds, and that may be not only your arteries, but veins. The number one killer of the adult population, unfortunately, is still atherosclerosis, a hardening of the arteries, and it really is epidemic in our population. And we treat a variety of atherosclerotic problems here with blocked blood vessels. We also treat a variety of venous disorders here. So as vascular surgeons, we really encompass the entire vascular system.
Well, what is PAD and PVD? I hear that used interchangeably.
PAD, PVD, you know, I like to use the word atherosclerosis, PAD, PVD. It is interchangeable. Plaque formation in your arteries, as I mentioned a minute ago, is the number one killer of the adult population. Unfortunately, our entire healthcare system, nothing's built around prevention. Okay, everything's built on utilization of technology to treat it. Okay, and that's why our cup runneth over, because with the aging of the baby boomers, with America's obsession with its rights to ill health, smoking and type 2 diabetes, atherosclerosis is really epidemic. So PAD, PVD, blood vessel disease in the leg arteries, arm arteries, carotid arteries, aorta, kidney arteries. Put it this way, anywhere blood flows, plaque can form. Okay?
And you treat those types of conditions
We tend to treat just about all the blood vessels. The cardiologists, our colleagues in cardiology, treat the heart arteries. We treat most of the other ones, and then there's some very esoteric, highly trained folks that treat intracranially, which is a booming field of small blood vessels in the brain. But all the other vessels really are in the parlay of peripheral vascular surgeons.
Now let's talk about varicose veins. I know
ma'am.
some people who have them, and I know that you do treat that here. What are varicose veins, and what causes?
Varicose veins are a manifestation of the cause, that is failure or breakdown of the venous valve mechanisms in the legs. Now, you lovely ladies are going to get that 30 to 50 times the rate of males. Sorry, Charlie.
Okay.
And that's something that
Why
God...
is that? Yeah.
Well,
Why
I'll tell you
is
what
that?
it is. It's really not always a gravid uterus. Estrogen and progesterone, especially progesterone, which you on a monthly basis you have a cycle of it, does cause dilatation of venous valves. The end result is failure of a valve. So blood that's supposed to come up the leg, low pressure venous blood, and go back to your heart, goes banging back down the leg. We use the word venous reflux or venous stasis. The underlying problem is the valves are busted. Now, interestingly enough, I've been in this business a while, as you can tell by my bald head, but until about 10 years ago, we just didn't do anything for veins. The operation, the procedure was obtrusive, very invasive. The cosmetic and physiologic or outcome results were terrible, and I'd go months without treating a vein because the procedure was terrible. The quantum leap came in our world with what we call minimally invasive surgery, the ability to go in a vein under local anesthesia and shut the vein down and treat that valve so the blood's not refluxing going the wrong way.
Now, besides the visual, because you can always tell if someone has varicose veins, are there any other symptoms?
You know, the visual are just part of it. Folks who are refluxing significantly will have pain, swelling, tenderness, aching. Believe it or not, 30% of people who have night cramps, who just twitching and their legs are aching at night, have venous reflux. And the problem is they've been refluxing all day long. They don't know it. They're working. They're thinking about something else. They go to sleep. Lights are off, and those veins are still distended. Nerve endings are irritated, and they hurt. The untreated, long-term result of not treating those folks is chronic skin changes. It becomes big word, lipodermatosclerosis, but it's almost like eczema, and then skin breakdown and ulcerations. And unfortunately, you know, an office practice like ours, we'll see 15 patients today with venous ulcers.
All right, and with that said, how can people make an appointment, get in here to get treated?
We have the ability to be seen in a multitude of places, not only our main office here, but in Walterboro and Hampton, the North area, Mount Pleasant, Berkeley County. We have 5 physicians. We have 2 physician assistants. and a very active vascular lab.
So
with
they
the
just
ability
need to
to
give you a
screen these
call
folks. Yes, ma'am.
and get that in.
Yes,
All
ma'am.
right, Dr. Morrison, thank you so much for
Thank
having us
you.
this morning. And I'll be
Right.
checking my veins. We'll be right back.